The number of confirmed coronavirus cases in the U.S. topped 4 million today, and the latest million came in just the past 15 days alone. So instead of giving governors and mayors the help many have been asking for to battle the virus's spread, the president instead announced this decisive action this week, which no one asked for.
The Department of Justice will immediately surge federal law enforcement to the city of Chicago.
As you might have guessed, that hasn't gone over well with major city leaders, especially after the kind of response we've seen in recent days in Portland, including the mayor there getting tear gassed by federal agents last night.
That's what we call tyranny and dictatorship, and we are not having it in Chicago.
When we ask for federal help, that's one thing. But when the President of the United States starts to use federal officers like his own personal police force, that's very dangerous for our democracy.
I just think that what the President is doing, it seems to me, by threatening to go into Chicago and other cities, it seems to be more political than actually dealing with the problem. They would not be welcome in Boston.
So with that distraction going strong, the president also returned this week to those daily White House coronavirus press briefings, now a one-man show. So why no medical experts?
They're giving me all of everything they know as of this point in time, and I'm giving the information to you, and I think it's probably a very concise way of doing it. It seems to be working out very well.
I'll respectfully dissent on that one, especially when he blames people who crossed the southern border for bringing the virus, or blames people who've been protesting against racism for spreading it, which studies have shown they did not, by the way. Not to mention all the times Trump has falsely claimed the numbers are only rising because we're testing more. Again, not true. The small bit of good news is he came the closest he has yet this week to telling people to actually wear masks.
I have no problem with the masks. I view it this way. Anything that potentially can help, and that certainly can potentially help, is a good thing.
The bad news is he's still refusing to wear them in public. So while he keeps flip-flopping on that issue, here's one he's been long consistent on.
I would like to see the schools open 100%.
He also said yesterday that he'd be comfortable sending his own son or grandchildren back to school in person at this point. There's one problem with that. His own son's school is only considering two options, according to a letter it sent out: a hybrid model and full distance learning. Here in Massachusetts, where we're doing pretty well, but so is California, schools are scrambling to figure out fall plans as well. Just yesterday, the State Department of Elementary and Secondary Education released an updated 34-page document outlining its guidance for reopening, plus another 15 pages on transportation. Students are encouraged to find ways to get to school other than the school bus. And there's a slew of recommendations about how to prepare spaces for students, keeping fresh airflow, eating in classrooms, and a whole host of other considerations. I'm joined now by Dr. Sandra Nelson. She's an infectious disease physician at Mass General Hospital and an assistant professor of medicine at Harvard Medical School. She's been helping to guide the Baker administration on school opening plans. Dr. Nelson, it's good to see you again. Thanks so much for being here.
Thank you so much for having me.
So on July 10th, the Commissioner of Education, Jeff Riley, urged local leaders to prioritize in-person learning. I know the state numbers are good. I've heard you talk about the negative effects of not being in the classroom, the low transmission rates. But since Jeff Riley sent out that communication, as you know, there's a study out of South Korea. And older kids, 10 to 19-year-olds, according to them, transmit at the same high rate that adults do. One, does that change your thinking? And two, should it change the states?
So I think that's a great question. There really are two key factors that really enable safe return to school. And one of them is the community rates of transmission, which we know are low and remain low right now. The second one is really what we can do in the school setting to reduce the risk of transmission. One of the challenges about our understanding is we've really never fully understood transmission likelihood and how much of that relates to biology and how much of that relates to behavior. The guidance itself was really never predicated on an absence of transmission. The guidance was really predicated on the idea that there could be transmission, and we really need to do our best to prevent that transmission. So that really is why we're relying on low community rates of transmission and all of the other mitigation strategies that have been put in place.
But wasn't it predicated in part on, I heard you say to us, I thought, on the radio, that the low transmission rate for children, now we know only younger children, was part of the equation too, was it not?
So I think that we do understand that younger children are less likely to transmit than older children. That hasn't really changed. We've understood that older children are similar in their behavior or their biology, probably to adults. At what age that occurs, I think, is a little bit of an unknown. The challenge with that South Korea study that you referred to is that it grouped children between the ages of 10 and 19. But we know that a 10-year-old is very different than a 19-year-old who's really a full-fledged adult. And so there are a couple of other, issues with that South Korea study, one of which is that they were very small numbers in that age range. And it makes it, those confidence intervals are fairly wide, which makes it a little bit hard to know exactly what that magnitude of risk is.
Well, let's talk about the community transmission, the criterion you mentioned a minute ago. Overall in the state, we have quite good numbers. However, as the governor identified, there are at least 8 communities, some of the poorer communities in the state, the Chelseas, the Everetts, the Fall Rivers, where the positivity rate is higher, for example. And the conundrum, it seems for me, is those are the kids who are in most need to be in the classroom, both for themselves, so there isn't even greater disparity than there already is between rich kids and poor kids, white kids and kids of color, but also their parents are less able to afford childcare. But at the same point, they're in a community where they're at greatest risk of infection. So how does one solve that puzzle?
I think that's a really challenging problem, and I think it's a problem that's going to needs to be a solution on a state level and potentially even on a federal level. It's very clear that some of these communities need resources. But you're absolutely right. If the rates of transmission in certain communities are too high, then we may not be able to achieve a level of safety in that particular community. And I think that is why there has to be some flexibility that is not only statewide, but is based on the communities and their own individual needs.
Which there is, and those communities are ordered to submit their plans to the Education Department by the end of this month. One last thing we broached when we were talking to you and the commissioner on the radio a couple of weeks ago is the teacher. We know parents obviously have choice, but what's your recommendation to the state and to the teacher about him or herself? There's a healthy 35-year-old, but she's living at home with a parent who's got an autoimmune problem, or there's an older teacher. She's 67 years old, or he's 67 years old. Should that teacher be able to opt out without penalty? What's your recommendation on that front?
You know, I think the decision about opting out is really a policy decision, but I can say that there's certainly different people are going to bring different risks to the classroom. And those that are higher risks may reach a point where they're not able to tolerate that risk. Even if we think we can get the risk down in a classroom, if that risk is non-zero, which we don't think we can get a risk level to zero unless community transmission risk is zero, then that individual is really going to need to think about whether or not it's safe. I will say that the same things that we're using to protect our students will also protect the teachers. And some of the plans that have been put into place have also created wider barriers so that teachers are really more separated from the students. The only other thing that I would add to that question is that we can really learn a lot from other countries that have already reopened. And so, for example, countries like Germany, which has reopened its schools, and Sweden, in which the schools really never closed, or at least never closed for any length of time. While there has evidence of transmission in schools, that hasn't really translated to transmission to teachers. It's been primarily the student-to-student transmission that has been seen in those areas.
Let's hope it holds here. One more factor I want to know if you consider. On one hand, we have Donald Trump obviously saying, as you heard a minute ago, 100% send him back to school, even though his own kid won't be doing that. I'm sure you've seen the Associated Press poll that came out a couple of days ago. 31% of Americans say don't open schools at all. In Massachusetts, 60% of black and Latino parents don't think it's safe to send kids to school. How much of what I think you called on our show the epidemic of fear, whether it's perceived or real, should be factored into decision-making about reopening?
Well, I certainly think that there is a lot of fear and anxiety. It's certainly something that we have seen in our own, in the healthcare industry, for example, as we really navigated our own reopening. I think that we need to take that very seriously. We need to be very transparent and forthcoming with students and teachers and families. We need to do our best to educate, to ensure that people are feeling comfortable. But most importantly, we really need to put those safety measures in place.
You know, Dr. Nelson, Massachusetts, Charlie Baker has been pretty transparent about most things. The numbers look pretty good. But as I said at the open, California was very aggressive early on in battling this thing. They were one of the first states to shut down. Are there any numbers, any metrics that are amidst the overall good trends here that are concerning you? For example, one thing that's cited by experts is the number of people that infected people actually infect, and the number has gone up just a tad. Or do you think we are on a solid track and that California is an outlier when it comes to Massachusetts?
Well, California certainly did some things differently than Massachusetts, and really they were very effective in their early response because they shut down very quickly, and they shut down fairly completely. But when they reopened, they really went on a different path. They did it much more regionally, and they also reopened much more quickly. So where we have limits on indoor dining, where indoor dining, for example, there has to be distancing, in California, those limits were not followed. Bars and nightclubs were opened early, and we don't even have that scheduled to open in Massachusetts until we get to stage 4. But I think your point is incredibly important. We really need to maintain our vigilance, and we need to wear masks and not be complacent, because if we are complacent, this could come back even in Massachusetts.
I'll tell you, whenever anybody says I made a good point, I got to mark that down and put it aside. Very quickly, in 30 seconds, advice to skittish parents, Dr. Nelson.
Well, I'm a parent too, and, I'm an infectious disease physician. I'm a mom. There's nothing that I want more than the safety and the well-being of my children. I really know that the best place for them for their education is at school. And provided we keep our rates of transmission low in the communities, and provided we have safety measures in place, I do think that it should be safe to go back to school.
I hope you're right. Dr. Nelson, thanks so much for your time. Hope to talk to you again soon.
Thanks so much.